So I'll go down who I've got participating right now. Of course, Jeremy with the city is hosting us and helping us get on YouTube and everything. Of course, we have Paul and Tracy McKee, Carolyn Murray, Katie Richardson, Dan Bornstein, Joey Current, Meredith Berlinski, and I've got one phone number on there. I don't know if it's a committee member or not,
That's me. It's Susan Johnson.
Okay, thank you. And so that's who we have here. So again, thank you for being here, and we'll jump right into it. And I ask Dr. Katie Richardson if she will give us her Dhec medical update.
Thanks, Kevin. I think Tracy, do you want to start and I'll go after you?
That's fine. It's completely up to you.
Yeah.
Okay. Well, go ahead, Paul.
Why don't we let Tracy go and give us a picture of the city, because you'll fill in all the gaps.
Sounds fine to me. All right, so I'm going to share my screen really quickly. I know that I've showed this dashboard before. I think we've made some adjustments and improvements to it since I last was with you all. So this dashboard is really focused on the city of Charleston zip codes. So we've got some basic stats at the top, and then we've got some primary metrics that we're actually tracking. Anyone who's looked at this over the last few months probably notices there's a lot of yellow instead of red. So that's a good thing. If I scroll down, we've also integrated the MUSC, their situation assessment. You can see, I believe they are going to be updating their stats today. Look at the Tri-County area, and our metrics are very much aligned with what MUSC has. So getting down to the growth rate and kind of that cumulative and active number of cases, you can see we were on a pretty good ride here in the red zone. That's what all those red little dots means. We were in the red area for our stoplight approach to the growth rate. And we're kind of in this yellow area. So we've seen a decline, and you can see that as well as our active cases. Down below that, we've got the social mobility, and then you can see our new cases. This is daily new cases in the city of Charleston zip code. So you can see this is on a nice downward trend. This last one, I think this is an addition since the last time I was with you all. If I turn off some of these different cumulative numbers, you can kind of see that the active cases are actually in each zip code are on the decline as well. So these are good things. However, if I scroll back up to the top, you will notice our testing percentage is fairly high. Love to hear Dr. Richardson's input on that. But also, we're seeing a real delay in testing results. So I feel like our numbers may be a little more positive than the situation actually may be, simply because it's taking so long to get results that I think some people are not getting tested, or they're having problems getting appointments to get tested. And I believe because of the delays, some places are only testing those who are symptomatic. So because of that, all those things, I think that the overall picture is a little murky, if you will, if we look just at these numbers. However, our conversations with the hospitals indicate that their COVID populations, at least at the local level, are slowly declining. So that's really good. And MUSC has indicated to me as well that they've had a decrease in the number of telehealth appointments. And that's that kind of first step for getting the test done through the MUSC channels anyway. So those are some tangible positives. So I think I'm cautiously optimistic that we're seeing some good things going on. And with that, I'm happy to take any questions, but I'll turn it over to Dr. Richardson for some more details and, like Paul said, to fill in the gaps for us. So thank you.
Any questions for Tracy, or should I go ahead and then we could both take questions unless.
I could add in with Tracy's as representing Francis has said, feel the same trend as MUSC. So we're on the same trend pattern as well.
Yeah, thank you. Stephanie's been sending me daily reports from Roper St. Francis. So yeah, this is, I mean, I think we're seeing some good things. So that's great. I know that you all were highly stressed just a few weeks ago. So I'm really glad to see that happening.
Tracy, is there any specific action areas that the Health and Wellness Advisory Committee could help in what the city's doing right now? I know a lot of it's going through City Council, but you've got the Health and Wellness Advisory Committee sitting out here. So is there anything that we should be assisting with?
That's a great question. And I'd love to hear Dr. Richardson's take on that. You know, Dhec has been really wonderful. Thank you, Dr. Richardson, for getting us some very targeted information of what's happening in the city. So we've started some targeted outreach to those areas that we've identified as kind of not necessarily hotspots, but areas that we see a number of cases within the city. So we're doing that. You know, I think for me, the biggest thing is testing right now. Testing seems to be the biggest issue and the biggest problem and the biggest hurdle. And I keep asking, what can we do as a city too to help with that situation? So I'd love to hear from the medical folks on this to figure out how we can all be part of the solution. So
you said use a Benadryl, like you said.
I didn't hear that. Sorry if that was a question.
I don't know where it came from. So.
Well, thank you for that. Any other questions for Tracy or for Dr. Richardson? Well, thank you for that.
This is Dan. I may have some questions after Dr. Richardson gives her report, so I'll just hold off for now.
Okay, great. All right.
Okay, Paul, am I up?
Yeah, go ahead. Thank you.
Okay, all right. So I want to say thank you to Tracy and really to give kudos to the city of Charleston overall for all that they have done to get these numbers down in Charleston County. Charleston County is the only county in the state that has had a downward trend now for 21 days. Even though we're now at 36 out of 46 counties with a downward trend, Charleston's really sort of, I think, you know, set the benchmark for that and has been very active and, you know, and really, I appreciate us push the envelope at Dhec for what data we are able to customize for cities and counties. And so thank you for that and keep the requests coming as they're things that can be helpful, because I think you've shown how these aren't just, it's not just data to have data and to put it on a website, but it's really actionable. And we are happy to assist when it leads to, you know, change in priorities in the community. Just to put a little bit in perspective, we are certainly improving, but South Carolina still has one of the highest mortality rates from COVID in the nation. And we're with Mississippi and Arizona right now for sort of the highest rates in the US. So, you know, one of my messages today is this is not time to let off the gas pedal. And we definitely need to be staying the course, even though we have seen these downward trends and are happy with those changes. As of yesterday, we had 1,168 new positives in South Carolina with the 18.3% positivity rate across the state. We're now up to 93,604 cases across the state, and certainly that, although slowing, it is very worrisome in of itself. Thankfully, our surrounding counties are also seeing downward trends. Berkeley and Colleton have had downward trajectory for over 7 days, and Dorchester for less than 7 days, but they are heading in the right direction. We have put out some metrics specifically for schools, but they, are available for anyone. I just wanted to make sure that everyone knows that if you go to the school's webpage under COVID and go to county level data, and then you have to click again to county level data, you do find metrics that look at the past 2 weeks by county. They look at incidence rate, trends in that rate, and percent positivity rate. And Charleston, just like Tracy was saying, just yet another way of looking at it is definitely moving in the right direction, moving from 886 cases per 100,000 to 712, and then most recently to 516. That still puts Charleston and all counties in South Carolina in the highest incidence rate. We want to see something under 200 to fall from that sort of high rate to the middle or medium instance, but we're definitely moving in the right direction. And the percent positivity similarly has moved from 24% to 21% to now 18% this week. So certainly in the right direction, but we put those out as a way of sort of emphasizing that the best way to get our kids back in school and to protect our students and teachers is to address community rates of COVID. And so that's certainly something I wanted to just make sure you knew where it was, and to know that that gets updated every Monday. So that's where to go for that information. The Low Country in general is seeing lower rates. We dropped about 11% over the past week. Percent positivity sits around 15% for the Low Country in general. We're now at 1,458 hospitalizations statewide, but as Meredith and Tracy were saying, those are remaining stable, if not slightly decreasing at this point. But we did have 52 deaths yesterday, and that's not just from one day. That's the time that the deaths were reported. But we certainly are concerned with increasing case fatality rates. And it's not surprising, perhaps, because we were seeing more cases in young people. Now we're definitely seeing clusters again in our nursing facilities and other long-term care facilities. When we look at ages in Charleston yesterday, of the 114 cases, and this is Charleston County, 76 of those were in residents between the ages of 15 and 44. So Charleston is still seeing a vast majority of our cases in younger people, but the number of cases in our 65 and older population is rising, and that's where we're still seeing 79% of our deaths. What else do I want to share here? So testing rate, Tracy did mention testing rate. Charleston sits at 176 cases per 100,000. Sorry, tests per 100,000. So that's certainly probably fourth in the Low Country for number of people tested. Currently, our goal continues to be 2% of the population statewide per month. That works out to 4,500 per day. We're now seeing around between 6,000 and 7,300 tests done daily. And Dhec does want to increase that goal. Exactly what it will be be somewhere between 2 and 10% for the goal of people tested per month across the state. So we'll hear more about that, but we've been testing at significantly above 2%. And I agree that we do need to continue to increase that further. To address some of the questions that Paul had sent me, we now have 84 case investigators in the Low Country. Those are the ones that reach out to those testing positive and give them information about isolation, and then ask for names of close contacts that will then be used for contacting those folks and giving them information on quarantining for 14 days from the day of last exposure, or 14 days after the end of isolation, if it's a household contact. And we'll touch base with them then every day sort of after that to ensure that they don't have needs for resources that we can share or symptomatic and need testing site, that sort of thing. Was I addressing from Paul? Paul also asked me to touch base briefly on our governor's latest executive orders. Those were enacted on Monday. They include social distancing in restaurants and bars, no congregating in those facilities, and mask or other facial coverings are required unless the person is actively eating or drinking at the time. The other part of it was public events are now limited to 250 people or 50% of capacity, whichever is lower. There are exemptions can be applied for through the Department of Commerce, and there are other, forget the entire list, but weddings and religious services are two that are exempted from that executive order. So that's my understanding of the latest executive orders out of the governor's office. And I think that's all. Well, I wanted to share a few other Dhec plans that are going on right now or will be coming out soon. We're working on potential guidelines for nursing home visitations. We know there's been a lot of loneliness and mental health concerns with the lack of family visitations, but we obviously need to balance that with the risk for clusters in nursing homes with additional people coming in and out. We're updating school operations and school bus guidance. There is new CMS guidance on assistance for nursing homes with cases, be that testing and federal strike teams that will be coming in if nursing homes have, I think, 10 or more new cases. So we're working to sort of figure out the process for that. Dhec will be releasing county dashboard data as early as later this week. And we can talk about that at the next meeting, or you can look on the Dhec website for that. Multi-system inflammatory syndrome in children. There's now a web page for that. On the Dhec website, we now have 7 cases statewide, 1 in the Low Country, and there is a map will be updated with that information. We have a number of Spanish language web pages now to offer education and guidance. And again, you can find those on the Dhec website. We are developing a contact tracing flyer. So we believe that all those who are tested need to get sort of the same information about please answer the phone when Dhec calls, and the importance of contact tracing and the importance, therefore, of sharing those contacts with us so that we can make sure that they have the education they need to protect their family and close contacts as well as the general public. We're working on university and colleges doing contact tracing as they begin to bring people students and staff back on campus. There's COVID immunization planning already, even though we don't have a vaccine quite yet. And I think that's what I wanted to share. Paul, was there anything else you want me to touch on that I didn't already? And then I'm happy to take questions.
Paul, I didn't know if you were going to say anything there. Paul, you're muted. There you go.
Hey, just a couple of follow-ups. Carolyn Murray made a great point at our last meeting to talk about that people are scared to get the swab up the nose or other items. And yes, it is intimidating when you do it first, but it's really just a few seconds. And the more we can do to get that word out, don't be fearful, but you need to do it, and it's not going to have any harm to you. I don't know how to best do that other than just keep sharing that message as much as we can, because it really does make a difference to just get them out, get them in there, and be realize it's only a few seconds and it's over with, and that it can do it. So I don't know if there's any other messages out there along that line that we could help push out, but I think we need to make sure we make it as friendly as possible for our community to realize that testing is a really big issue to do.
Right, absolutely. And the drive-through testing through Roper, MUSC, Fetter, it is a pretty easy process. And so, yes, both the swab itself and the entire process of testing. I do think we need to continue to work on increasing access, both within the city of Charleston specifically, but also statewide. And I think it will help to set up some more sort of either static facilities, which means facilities that are there all the time for testing, or at least have a sort of regular rotation. And I think there's some movement towards doing that, even with the mobile testing sites, of having a regular rotation so that citizens know when they can expect sort of another testing event in their neighborhood.
Good. One other question Jan Park had from our last meeting was asking about the rapid test and its accuracy. And Mary answered a little bit about, but can you give us a Dhec perspective on the rapid test?
Well, so there's not just one rapid test. So every test has its own, sensitivity and specificity. There's now self-testing with saliva as well as the anterior nasal swab, and then there's rapid test done through providers that might be any of those swabs as well, either an antigen test or a PCR test. So I can't speak specifically to any one test off the cuff, but I think the specificity, meaning if it is a positive, is that a true positive, is very high. So I very much believe, and Dhec agrees, that a positive should be believed. The negatives, sort of the false negatives or the sensitivity is what there's more concern around. And so these rapid tests have lower sensitivities than what I call the send out PCR test. And so I think the message there is, number one, I think it's a fine first step, especially as we're continuing to work on accessibility of testing. But if someone has if we have a high index of suspicion that they are, had a close contact, that they have are very symptomatic, that looking at other differential diagnosis, like, there's for instance, for, kids, if there's a negative strep test, or as flu season gets going, a negative flu test and symptoms persist, that might be someone that then needs to return for the more traditional send out PCR to confirm that negative that they may have gotten from the rapid test.
Yeah, I know we're having so many in our public safety and public works type service areas of concern that when one comes down in a crew, we really need to get fast testing to try to figure out how big of an impact that is for our workforce first responder type groups as quick as possible. And we're just trying to look for, because a lot of the testing that we've gone to that's on the private side sometimes is 7 to 10 days, and that's almost a length of the time period. So we know that the hospitals have been swamped, and so they're really only testing people who are symptomatic
Yes.
efforts sometimes. And so we're really just trying to find as many vehicles out there of how do we get our public safety people or first responders or the storm warders or garbage collectors or how do we get them the fastest test and what's most reliable and helping us with that. So that information is helpful for us knowing a little bit more about what's available.
Yes. Well, and I think, all systems that are doing testing are working on improving the turnaround time of their testing results. And we are working on that with the Hospital Association as well. And so we do hope to get to a place where, where their turnaround time is more in the, 24 to 48 hour range. As opposed to that 7 to 10 days, because I agree it's not actionable for public health or for you as employers to be getting a result that far away. That being said, we definitely, even with a negative test, especially if it's a rapid, for continued symptoms, people still need to stay home until those symptoms resolve.
Thank you. I think Dan Bornstein has some questions.
Hey, Dan.
Yeah. Hi. Thanks, everybody. And Tracy and Katie, particular thanks to you in providing us data. We know the importance of data in helping us to inform policies and individual behaviors. And we also know that the data reflect behaviors and policies that may be implemented. I guess my question is, what policies and or behaviors do you think led to the spike that we saw? And similarly, what policies and behaviors do you think are leading to the current trends that we're seeing that we'd like to see continue? And so therefore, what policies and behaviors should we continue to really emphasize going forward? That's the first question I have, and then I've got another question.
Tracy, you want to tackle that first, or you want me to?
I'm gonna defer to the medical professionals on this one.
Okay. So, I guess I'll look at the positive side of it and say, I think the mask ordinance that Charleston put in place back at the beginning of July has made a huge difference. I think it helps to change the culture. And I think we could all say that we've seen much more facial covering use since that ordinance was put in place than beforehand. I think limiting group gatherings is also very important. And so, I am certainly not recommending gatherings of 250 people or our residents attending such gatherings. I think that will lead to increased infections. But certainly places like schools that, when they open are often going to have more students than that are putting significant time and money into improving the social distancing that will happen in those locations. And so I think that is important, not only for schools, but for any other gatherings that happen that bring together larger groups of people. I think as our college students come back, certainly thinking about places that they congregate in the city and ensuring social distancing as well as limiting these large gatherings will be important. And I do hope that the new executive order, which limits the congregating of of groups in restaurants and bars will be helpful, along with the ordinances in place, limiting alcohol sales after 11 p.m. and, limiting loud music. Those sorts of things, I think, will help to decrease sort of the impact of bringing all of these young people back into town to be in schools. So those are some of the thoughts that I have about policies. And then, as I said, earlier, I just feel like this is very much the time that we need to stay the course, if not, put additional measures in place such that we are able to allow our children to return to school, and so that we're able to increase confidence that Charleston is a place that values health and will protect, whether it's visitors coming or the public going out and, returning to our shops and our restaurants. I think the more sort of assurances we have in place will certainly assist to allow us to be able to do those things that we feel like are most important this fall. The last thing I would say is, flu vaccines are not yet available, but they will be available soon. And I think flu vaccines are important every year, but especially this year, where so many symptoms are similar between flu and COVID-19. I think making sure that we provide access to flu vaccines and that we encourage them for all of our citizens, I think will be especially important this flu season.
Yeah, thank you, Katie. Very helpful. And I guess another question I have, and this is, I think, maybe a little bit more conjecture, I'm not sure on your part, but obviously we hear a lot about fatality as an outcome, and naturally death is an outcome that we all very much want to avoid. I wonder if you have any information about some of the non-fatal outcomes that are resulting from this virus that certainly I'm not hearing a whole lot about, but I wonder if you, from inside the medical community, have any insight you can share with us about outcomes from this virus that aren't fatal, but that may be serious.
Mm-hmm. Well, so this may be a better question for Meredith or for sort of practicing physicians. But my first stab is certainly the inflammatory syndrome in children. Although it is rare, it is still concerning and has not led to deaths here in South Carolina, but certainly affects multiple organ systems in generally, previously healthy children. Much more common or sort of more, again, it hasn't been that long term, but sort of more chronic sequelae in adults. And so we've certainly been concerned about stroke and other vascular events, also in often young, healthy adults. And other than that, off the top of my head, I'm trying to, I think fatigue, certainly that people aren't bouncing back. Not everyone is bouncing back, at least to feeling, themselves again after sort of the 10 days that we usually ask someone to be isolated. And so I do think that this is so. Other than that, I think that it's a great question, and there certainly are other long-term, or at least as long-term as we've been able to follow folks, sequelae. But perhaps Meredith, or I can certainly, speak to this in greater depth, next month. Meredith, you have any thoughts?
I was just really shaking my head with you, agreeing with everything you're saying. A lot of the a lot of the long-term effects are yet to be known, but we are seeing a lot of those of the inflammation in children, and I think some of the things that are coming from this virus that we've seen have been just odd in the case, and we're actually even some years of flu symptoms have developed into something else, but this COVID being the second SARS virus, it is family with the initial SARS virus. It's just replicates quicker and it's harder to destroy. So that sudden acute respiratory type symptoms are going to keep going. And a lot of people, we put a 10, like you said, a 7 or 10 day about how long the virus is going to last, and all that is just an estimation, really, because we've seen patients not get their sensory back of taste or smell for even a week or 2 weeks after their symptoms have disappeared. So yeah, those kind of things we're just keeping track of what we're seeing. What we haven't seen specifically a lot of extra symptoms in the hospital. A lot of patients are going home. We're playing some Justin Timberlake or intercom when a patient leaves, just a little celebration. And we're seeing not more than just a few weeks ago, we had 44 to 48 in-house COVID patients just at St. Francis Hospital. And today on Huddle Call, I heard them call out 18. So we're getting better. We're shifting out to get more surgical patients back in here that need help as well. And Robert St. Francis is making that change. But as for long-term, I think some of that's going to be a wait and see, because we have seen some cardiac and some respiratory issues that have streamed out.
Okay, I think I saw Joey had his hand up. Joey.
Yes, thank you so much. Dr. Richardson, back on the conversation around testing, I think it's fairly clear to folks in the general community that if someone has symptoms or experiencing symptoms of COVID, they should go get tested. What are your thoughts on folks who are not symptomatic, but maybe hear about somebody that they were around that then they found out later went and got tested positive? I think there's some confusion, especially from employers and then generally folks in the public about, should I go get tested just because I was around someone who I found out tested positive, even though I'm not showing any symptoms at all?
Mm-hmm. Yes, I think I agree with you. I think there is some confusion there, and I think that is because of the caveat about testing availability. So I think if we had, unlimited testing access and availability, then DHEC's recommendation continues to be that around day 7, if you're identified as a close contact, so that's greater than 15 minutes within 6 feet, or some sort of direct contact, like hugging or sharing utensils, if someone calls or sneezed on you, you don't need 15 minutes if one of those things occurred with someone who was infectious at the time. So for folks identified as close contacts, our recommendation is still to get tested around day 7, but that is dependent on testing availability. And as we've just discussed, testing availability is not where we would like it to be right now. In the Charleston area or across the state, and there are many reasons for that. And both DHEC and providers doing the testing in the community are all working to improve that access. But I think that is the key. So at the moment when access is not as available, then I think we're erring on the side of saying, please be aware of symptoms, please do self-checks for any symptoms at all. Being completely asymptomatic and you do not have access to a test, you do not need one, because the test will not decrease your time in quarantine. But once it becomes more available, then it is certainly something to consider.
Okay.
That answer your question?
Yes, thank you very much.
I know they're still hedging there, but I think that is part of the reason that it's a difficult message to get across to the public.
I think Tracy had a question as well.
Yeah, I did. Thank you, Mr. Chairman. I just really want to make sure I publicly thank Dr. Richardson for her responsiveness to all our insane requests to her.
They're not insane.
I'm amazed at how responsive you are to all of our requests. I know, because I know that you have got to be completely burning the candle at both ends, if you will. So we appreciate all that you've been doing for us. I just have one quick question. I'm curious as to what impacts the new federal reporting requirements have had on Dhec.
So you're talking about the change in the hospitalization reporting from the CDC to HHS?
Yeah.
You know, I'm not intimately involved in that. That's really done through our Division of Acute Disease Epi in Columbia. But I think there have been hiccups in the, you know, in sort of the change in system. And even now, it's difficult to compare sort of the hospitalization data from the old system with the new system, because the new system, at least the last time I checked, was counting all beds. So even counting sort of, you know, bassinets in the NICU. Well, obviously we're not putting, unless it's an infant, not putting COVID adults, you know, in those beds. And so I think that's one example of how there's been some growing pains with this transition. And Dhec doesn't want to put out data that, you know, that is not meaningful. And so we are still working through that. But when you see data on our website, it is data that we feel, you know, more confident. When we don't put out something, it's because we don't have that confidence, and there will be differences regardless. But we're certainly working to understand it better and working with the hospital associations who are, you know, providing that data to the new system to ensure that it's sort of actionable and to make sure that we have a good grasp then if, and I hope it doesn't happen, but if it becomes an issue again, as we have had even recently in this area of there becoming sort of greater shortages for bed space for our COVID response.
Paul?
Kevin, I just want Katie to repeat one more stat. She talked about the flu over the last 10 years compared to where we are today. Remind us of that.
Yeah, so I don't have it in front of me, but basically the deaths that have occurred from COVID in South Carolina over the past 5 months. So, you know, since we had our first death, which I think may have been in early March, that number is greater than the combined deaths from flu over the past 10 years in South Carolina. And so that was certainly startling to me. And I look at this data, you know, every day, and I look at flu data also often. And, you know, to Dan's point, there's also many sequelae that are short of death that we also need to be concerned for and getting the message out about. But our deaths from COVID have been significant in South Carolina and around the world. And so, again, to me, that's, you know, continues to underline the message that this is we should certainly celebrate our decreases, you know, our improvements, but this is not the time, in my opinion, to back off on any of the policies that we have in place to decrease transmission. We want our percent positivity rate to continue to go down. I would like it definitely under 10%, and, you know, ideally more around the sort of 3 to 5% range. And we want our incidence of new cases, our incidence rates to continue to go down significantly. So it's moving in the right direction, But we definitely would like to see continued improvements, both to curb those deaths and generally to ensure that our public has greater a sense of safety for going about the things that they need to do in their daily lives.
Any other questions for Dr. Richardson? Well, Dr. Richardson, thank you so much. Appreciate all that information. That was very helpful to us, and a lot of information. We really appreciate it. But if there's nothing else there, we'll move to, I see Lori Yarborough has joined us from City of Charleston Recreation. And if Lori, if you'd like, if you would give us a report, we'd appreciate that.
Absolutely. Thank you, Chairman, Councilmember Shealy. So one of the things that I know Paul had asked me to please update you all on is the continuing efforts in the Parks and Recreation Master Plan here at the City of Charleston. It's interesting to run a data-driven, fact-gathering, information-seeking project in the middle of a global pandemic. So our consultants have had to really pivot, but they have done a couple of things. They've got a SurveyMonkey master plan survey up that any citizen can participate in and give us ideas of what they need, what their area doesn't have, does have, what they use. We're also doing, they're going to do some open houses, but not in the traditional way. They've picked some parks that we probably would have little representation using online data. So they're going to be in some parks starting next week, socially distancing, wearing masks, just asking folks some questions. They're going to use one of our tents so that people will recognize it as part of the city's plan, but try to get some data from folks that way. There's also some stakeholder group discussions that are going to be done virtually with some different groups that exist out there that maybe have field needs or citizens that want more pickleball courts, for example, things like that. And then there's also a mind mixer that's set up where we can give input, citizens can give input year long throughout the process. So we're really trying to get information in a very safe way with this virus going on, but we have not stopped our efforts. Inventory about programs and parks are going on, and there's still time to participate. That's on the city's website. It's also a part of the Facebook page for the Recreation Department. So there's a lot of ways citizens can get a hold of that. There's even some paper copies that we can send to people. If there's some areas that may be underrepresented, we need to do paper copies. So working hard with our consultants to kind of move forward with this project. Like I said, difficult times, dollars are short. It's hard to get people's input, get them together, but it doesn't mean, as a matter of fact, in my opinion, professionally, this is a time that our people need our parks and recreation facilities and programs more than ever. When we can't do things or when money is a barrier for certain folks, we need to make sure our public facilities are open and safe and providing an equitable opportunity for all citizens. And so that's really what we're working hard for. So those efforts continue, even if you don't see them the way we thought they would be when we started the process in January. Can I also brag that with the help of some really, really good recreation staff and my doctor on call, Tracy McKee, we have navigated through a summer of summer camp that I wasn't sure how was going to work when we started it on June 22nd, but we have done really well. Starts. We've learned a lot along the way, but the guidelines that have been provided to us, Dr. Richardson has helped with that. Jam Park has helped with that. We just had a lot of folks, CDC obviously. So I'm very pleased with what we're doing, and we are set to try to do some fall sports. We've had the highest registration we've ever had in the first 3 days that it's available. I think parents are wanting to have their children outside and playing things, making a lot of modifications to keep it safe, but really excited that families have some trust in us and are still looking for us. So that's kind of my update.
All right. Thank you, Lori. Any questions? Any questions for Lori? Well, thank you for that, Lori. Appreciate that update. Thank you. I thought maybe we would ask Dan if he had any updates on what's happening at the Citadel and maybe some of the other colleges, and maybe anything that's going on there.
Thanks, Mr. Chairman. I'll provide a brief update, which is that the Citadel has taken extraordinary measures to try to ensure the safety of all the faculty and staff and students, including not just our cadets, but our daytime students who may come in the evening and graduate students and so on. Our plan is to return to a new normal level of operations. Obviously, the operations won't be anything close to what they were in the past. But we have taken just about every precaution we can, from a social distancing perspective, to a mask wearing perspective, to a sanitation perspective. The mask is now a part of the uniform of the what is called the South Carolina militia, which includes our faculty as well as the entire Corps of Cadets. So anybody on campus will be wearing a mask. We'll be limiting the extent to which cadets will be able to go out into the community to just those things that are absolutely necessary. For example, if they have to do an internship as part of a completion of their degree program, we're looking at those on a case-by-case basis to try to ensure that, again, their risk is minimized. From an educational delivery perspective, we are limiting the number of students in a classroom at any given time to ensure social distancing, so that if we can't fit all students in a classroom at once, then that class will be basically simulcast to students, and we'll have a rotation of students who are actually in class versus those who might be watching it live remotely. And we're hoping to be able to continue that through the semester. And if the virus, if we do have a massive outbreak and it does dictate that ultimately we have to shut down, which we hope is not the case, we have a very robust system for full online delivery of our material. So if the health or public health dictates that we have to go in that direction, then we certainly will. But again, I think overall we're set up as well as we possibly can be. We were fortunate to have had what were called poolees, which are individuals who are about to ship off to basic training for the Marine Corps, but are not yet at basic training. We had them quarantining at the Citadel all summer. And that provided us a really good opportunity to test some of these systems. And that went very, very well. So we learned a lot from that, and that informed a lot of how we're going to be doing things going forward in the fall with our cadets and faculty and staff.
Thank you. Any questions for Dan? Well, thank you for that. Appreciate that. I don't think we have anyone with the College of Charleston on, do we? I don't believe, and I don't believe we have anybody with Charleston County Schools on. I think Maggie
No,
came on and off.
but I do have a report from Maggie.
Oh, good.
She said that she's in between meeting with teachers today, but she said that most recent updates would be the launch of their virtual academy enrollment. It links available. I've got the link I'll send to y'all, but the VA is for students who want to learn full-time virtually, who do not want to return in person for instruction. There are on and off ramps for the academy, 9-week for K through 8 students and 18 or semester marks for 9 through 12. So high school students would have to do 18 sessions to be able to do it. But in general, the virtual academy that belongs to CCSD and is staffed by CCSD teachers who are dedicated to teaching within the academy. She said this differs from their in-person instruction that will begin temporarily remote for all learners, with the exceptions of the students' families who really need their children in a building in face-to-face learning at the start of the area, which I think that's about the certain building capacity is going to be probably 25%. But anyways, I'll send all that information out to you in just a little briefing from her and let you know. But the school district, all that information is on their website. I heard they were offering another version of the plan today to try to address how to do it virtually in and out of the schools. So a blend is what I heard it was being introduced as, but our prayers are with them. They've got their hands full, and Dan, everybody's got their hands full, but these children are so precious that we've got to make sure we protect them and the teachers. I'm worried more because I have a wife who's a teacher about how the safety will be in the classroom around them, because you can wipe out a whole classroom if somebody's sick in close proximity. So they just got to do all those things that Katie said, keep the pedal to the metal, and let's try to keep this face mask and social distancing and all that in place. But anyway, so Maggie will be out for a little bit of time. We'll miss her for a couple months, but she'll be back with us before too long.
All right, thank you, Paul. Appreciate that. And I know Councilman Seekings couldn't be with us this morning. Is anyone that wants to speak on the bicycle plan?
Susan Johnson's on.
Okay, good. Susan, can you hear us?
Yeah, sorry, I'm traveling and eating my breakfast at the same time. From what I understand, two parts of the recommendations from the Traffic and Transportation to the Traffic and Transportation Committee from the Bike and Pedestrian Committee were approved, that being Market Street, and I'm sorry, I don't have it in front of me, so I can't remember the other one, but the council requested additional information, and Councilman Shealy, I think you can probably speak to that since you were probably there better than I can. I do know our new CEO, Dr. David Zoss from MUSC Charleston Division, submitted a letter of support for the entire Open Streets pilot program. And, we had that conversation in our last meeting that I think all agreed that it was worthy of our support as well, but we just didn't have time to get an official letter in. But I think there are still opportunities for that, and I'm happy to help draft that and get that out to everyone if the group thinks that's of value.
Okay, well, thank you very much. Appreciate that. Any questions for Susan?
Kevin, I apologize to Susan and Mike. When Susan sent that letter out about the same time my mom was passing away in the hospital, and I wasn't able to get it out to all of y'all, but the question I have is that something that we want to endorse from a health and wellness, that we are supporting the open street concepts that the bicycle and pedestrians are working on?
Yeah, I think it's I personally think it's a good idea. I don't know if you were asking Susan specifically.
Yeah, I mean, I definitely agree, but I think it's something that we probably need to put to a vote. And I don't know, Paul, I think I did send you the draft.
You did, and
so
I'll send that out. Yes, I'll send it out again. But
maybe we can just do it via email vote.
I'm not sure we can do the email vote. That's why I was just wondering whether we should do it as a concept that we all are agreeing or not. Kevin, your thought?
Okay.
Yeah, I mean, we could certainly do that as a group right now. I guess if someone, I don't know if we need to look, I don't know if everybody needs to look at it first, if we want to, do that now. If somebody wanted to put forth a motion and second it, we could certainly vote on that.
I'm happy to put forth the motion as long as everyone feels comfortable with their knowledge of the Open Streets plan. And I apologize again because I'm driving, so I can't share that. But I know we had a pretty thorough conversation with Councilman Seekings at our last meeting. So, and maybe if there are any questions, Councilman Shealy, since you probably have the best knowledge of what was presented to council, maybe you can answer any questions before we make a final motion.
What if we get the information out and would it be too late to ask for us to take that information and maybe vote on it the next meeting, Paul? Do you think that would be okay?
Yeah, that won't be till September. I didn't know when y'all might have it come before you. That's the only reason I was asking.
Okay. Okay. I mean, I want everybody to feel, comfortable with it and be able to read through it. But I don't know if it's on the agenda next time or not. I'm not sure. Our next meeting is what, August 17th, and then the following meeting will be after our, it'll be after our next meeting, I believe. So I'm not sure if it's on this coming agenda yet or not. I don't even think the agenda meeting's been held yet. So.
Yeah,
Are there any concerns from folks on the call now?
Nope, I don't think
Concerns?
everybody should go ahead. No. Go ahead, Joey. I'm
I
sorry.
was going to say no concerns from me. The concept is outstanding, and it entirely supports the Healthy Tri-County Health Improvement Plan in the way that it improves the access for physical activity for folks, especially during this time when folks are trying to stay socially distanced and all of that. So I support it.
Yeah, this is Dan. I would actually second the motion and support it, and briefly editorialize that I think one of the great benefits that we've seen as a result of COVID-19 is a lot more physical activity in our neighborhoods. And so I think it's an opportune time to put forward something like this that's going to ensure that opportunities for physical activity across the entire metropolitan area increases even after traffic levels start to increase, particularly as more people go back to work and so on. It becomes increasingly more important that we have streets like this that are reserved for physical activity. So I think it's an opportune time to put something like this forward. So I will second the motion.
Okay, great. So we've got a motion by Susan Johnson, a second by Dan Bornstein. Paul?
Kevin, what the strongly urging council to do is open a segment of South Market Street, Church Street to State Street for safe bicycle and pedestrian use, including business patron access. The City of Charleston staff already surveyed the interests of businesses and vendors and garnered support in the range, was number one. The second part was approving a temporary parklet, a pilot program for businesses to utilize city-owned street parking spaces except King Street for expanded outdoor operations. And the third one was directing city staff to study the potential for including bike facilities on Wentworth Street as an east-west bicycle route across the peninsula. Those are the three items that Susan had included in the letter that I'll send out to y'all right after this meeting.
Okay, great. Any other questions or comments on that? All right, so we've got a motion. We have a second to support the open streets plan. There's no other discussion. All in favor, please say aye. Aye.
Aye.
Aye.
Any opposed?
Aye.
Okay.
The aye was in favor.
Yeah, thank you, Dan. All right, so that motion passes, so we'll send that on. Thank you. All right.
Aye. Late, sorry.
Thank you, Carolyn.
100% support. Thank you.
Very good. Okay, Paul, who are we missing on here? What else do we need here?
The only other item is I wanted to, Susan was on the line and we sent out something last night, but the Charleston Healthy Business Challenge was an invite for you to be able to listen to our last show that we did, but not show, seminar we did that talked about mindfulness and purposefulness. I'll get it out. And it was a great webinar, and they have an invite there for 3 months for everybody to be able to experience this little app program that really helps you focus and refocus on what you do in your daily life at work and in individual. And it was just it was a great seminar. We encourage people to take advantage of the Healthy Business Challenge. It's a free program for the community, the city, and really our health and wellness committee, y'all group, everybody focused on, but between MUSC, Susan's leadership and the cities, we were able to pull this together. This is our fifth year of it. But it's a great opportunity, but I really wanted you to take advantage of that seminar I sent out to you and the link to it, because it's a nice way. It gives you a little yoga or mind or relaxation during the middle of the day, and it's a good learning tool for you and way to go back and get your mental health in order to be able to make it through the rest of the crisis that we're going through. So,
all right, very good. Well, thank you.
Share that invite.
Anyone? Oh, go ahead, Dr. Richardson.
So I had one other thing I wanted to mention, and I know we're over time, but Fast Track Cities initiative to end the HIV epidemic that this committee recommended and then was enacted last June with Mayor Tecklenburg signing the declaration. I presented the dashboard probably 2 months ago at this meeting, and now we're ready to sort of move forward to next steps. And so I wanted to invite everyone in this group to join us on August 27th from 12 to 5 p.m. virtually. There will be a Fast Track Cities Charleston implementation planning meeting. And certainly there is already representation that will be there from the Ryan White Wellness Center at Roper and MUSC and Palmetto Community Care. But we very much hope to, expand that and have more representation from the City of Charleston government and others on this call that have interest in ending the HIV epidemic. Certainly it'd be great to have United Way and our colleges and universities involved as well. So Paul, I think, has the information and we'll share it with after this meeting. Correct, Paul?
Right. And we have on our next agenda, Eric is going to be on our, O'Brien is going to be part of the September meeting to give our quarterly update on it as well too.
Wonderful. Thank you.
All right. Thank you, Dr. Richardson. I appreciate that. Anyone else? Well, I just want to say thank you to everybody. I know all of your time is extremely valuable. Thank you for what you do for this committee, but thank you for what you do for our community too. And this is very important for the city of Charleston, all that you do and your input. And we don't take that lightly. We appreciate it. Paul, did you have something else? I'm sorry. Saw your hand
I
up.
just want to introduce, you might see her picture on there. Alyssa Mathiason is interning with me for this month of July, and she will be graduating as of Friday. She will have completed her work and will now be hitting the world in public health or health.
Yeah, thank you so much for having me.
So, great job. Thank you.
I've learned a lot. I really appreciate what everybody does for the community as well. It's heavy work here.
Oh, thank you, Alyssa. Appreciate that. And again, thank you to everybody. Please continue your great work. Help us to spread the word for everybody to wear that mask, obviously, to wash your hands, to keep socially distanced and keep out of those large crowds and things like that. And just keep up all your great work. I appreciate it. And if nobody else has anything, we'll stand adjourned. Thank you.
Everyone should expect phone calls from reporters today.
Thank you,
Thank you, guys. All
By the
right,
way,
be safe. Thank you, guys.
We have
Congratulations, Alyssa.
We have been
Thank you.
live streaming on YouTube, so it's a way to see.
Oh,
That sounded like a threat from Carolyn.
Thank y'all.
Thank you.
y'all. Take care.